Hey, I'm Emma Grace. I'm in Kines 220. I'm going to show you how to properly bandage an incision wound. So first thing that you're going to do is you're going to introduce yourself to your patient, make sure that they know that you are first aid certified, and ask them for permission to help them. So, hey, I'm Emma Grace. I'm first aid certified. Can I help you?
Yes.
What seems to be the problem?
I have an incision wound.
So once you know what's wrong with them, you're going to make sure that you wash your hands with soap and water for the appropriate amount of time. And if you don't have that, you can use hand sanitizer. But you're going to make sure your hands are completely dry when you're done with that so that you can put on your protective gloves. You're going to put them on like this up past your wrist so that they're covering well. Okay, and so the first thing you're doing is you're going to put gauze on top of the cut and apply pressure. And if it bleeds through this, then you're going to apply another one and do so until that you don't have blood coming through. But you're never going to pull off this first gauze pad, because if you do, you risk the chance of pulling off a scab that's already formed. So once you have this gauze on their arm or wherever their incision is, you're going to start bandaging it to hold that gauze onto it. And you're going to use all of the bandage, and you're going to wrap it tight enough to where there's enough pressure applied, but not too much where it's hurting the person. So once you have all of that done, then you make sure with them that it feels okay. So is that too tight?
No, it's good.
Okay, perfect. And so after you've done this, you have completed bandaging. You're going to take off your gloves, like we were taught to. And then you're going to dispose of these in a plastic baggie until you can get them to a biohazard waste bin. And that is how you properly bandage a wound.